One of the things you'll see if you look at a lot of the studies on hospital outcomes and success of different hospitals, uh, far and above the physician-owned facilities perform much better than any of the other facilities, whether they're public or private, but the private physician-owned facilities have far outperformed because the physicians have control. The administrators don't have control. You have physicians making all the decisions, the appropriate decisions. In keeping with paradigm, Sterling was an obvious alignment in that our physicians, our specialties wind up referring patients for surgery. A number of our specialties do surgery. And one of the biggest complaints you'll see from surgeons is they have no control over their operating room. They are dictated to. So one of the big pluses of Sterling is the physicians who operate here own the hospital. So they make all the decisions. They buy the equipment they want. They bring in the staff that they want. Again, just like Paradigm, we're very picky. We get to choose. We don't have some hospital administrator saying, here's your OR nurse. No, the surgeon interviews and decides who his OR nurse is. This has resulted in phenomenal outcomes. The infection rate is basically nil. The surgical outcomes are fantastic because you have an entire team on the same page, working towards the same goal. It's almost impossible to create that environment in a large bureaucratic facility. But here in a smaller facility where you have hands-on, day-to-day, by the physicians, seeing what's happening, seeing what needs to be adjusted or fixed, taking care of that immediately leads to perfect outcomes. The post-operative pain management here at Sterling is phenomenal. The patient satisfaction rates are through the roof. And again, it's that warm, boutique environment as opposed to that stale hospital environment that most people see. How do we create just a pleasurable experience for the patient? How do we make it easy on them? So we've actually created a position called the patient liaison that is the initial contact for the patient who keeps track of everything that's happening so the ball doesn't get dropped in between point A and point B. Any complications or issues a patient runs into, you have that patient liaison who's in constant contact with you, making sure the process goes smoothly. Patients love it, absolutely love it. Having that person, that personal attention by someone other than just a nurse or just a doctor. It's kind of that confidant. Hey, I'm walking you through the process, able to answer the questions that sometimes they don't want to ask the doctor, they don't want to ask the nurse, or just kind of that go-between.